Welcome back. The South African Medical Technology Industry Association is urging the government to address what it describes as an unsustainable level of debt owed by the public health facilities. Meanwhile, the Democratic Alliance in Gauteng is calling on the health department to resolve internal challenges, including the more than 4.8 billion rand owed to suppliers. SA Med warns that some companies have been forced to retrench workers due to non-payment by hospitals. Joining us now is the SA Med CEO Tanya Vogt. Tanya, very good morning to you. Thank you so much for making time for us this morning. I just quickly want to read from the budget speech that was delivered earlier this week by the Minister of Finance. When it comes to this specific issue around the service providers being owed, he says that accruals in the sector, which the money owed by the department to vendors for services already provided, has ballooned to nearly 22 billion rand. How did we get here?
So, Aldrin, good morning, and thank you for this opportunity. This is not just something that is recent. It's really been an issue that's been ongoing for at least 15 years. SAMED has been tracking this, and at various points in time, we have raised awareness. We've had some success, but I would say in the last year or two, things have really become quite dire. And with just 50 of our members being owed more than 1.1 billion, the situation is really now quite serious.
The situation is now quite serious, but how did we get here? How was this allowed to happen, even though we know, at least with the Public Service Commission, that they're clear that when it comes to the payment of service providers, they must be paid within 30 days. And I know that it's a bit difficult when it comes to medical service providers, considering the amount of money that we're speaking about here.
So both SAMED and our members are really deeply committed to patients and to the provision of healthcare. So generally what happens is the suppliers supply, they keep on supplying, they don't get paid, they then stop supply, government then pays them and they start supply again. In a very small amount of cases, certain suppliers have taken legal action, and that has forced the hand of government to pay them. But it really is coming to a point now where a number of the SAMED members have completely stopped supply, and they've actually said that they can no longer continue bankrolling government.
What's the risk then to the health system if you have some of your members stopping the supply of their services?
So you must remember that medical technology is a vast array of types of products. Some are life-saving, like ventilators or incubators for premature babies. Others are more simple types of products like syringes or surgical gloves. But certainly if there are products that are not being supplied for emergency-related, critically ill patients, the consequences could be dire.
The consequences could be dire. What do you think the next step then should be around how do we deal with this and also avoid it from happening again?
So I think we need to look at some very short-term as well as long-term solutions. And for that, we need the right people in the room. I believe that we need the MECs now, not just of the provincial departments of health, but even the finance departments to get together with suppliers, with the likes of ourselves as a trade association, including the national ministries of finance and of health. And we need decisions to be made at the highest levels so that we can really make sure that those that are accountable and actually have to implement new procedures or policies or systems do so.
Yeah, what will that change though, Tanya, considering that you have the Democratic Alliance in Gauteng that are saying that about 4.8 billion rand is owed to suppliers. Then on the other end, you already have policy from the Public Service Commission around the turnaround, the norms and standards around when service providers should be paid. That is not being adhered to. Gauteng is actually one of the biggest culprits, its health department to be specific around this as well. And sometimes the Gauteng Health Department is arguing, Guti, it is because of challenges that they are having with these service providers themselves.
So So I don't think this is just a budget issue. I really think that it is something systemic, and we now need to look into how the various provincial departments of health actually work. What are the financial systems? What are the levels of governance? Who is accountable? Are efficiencies actually being considered? Are we doing away with antiquated paper-based systems? So it's really going to take a deep dive. There is a meeting that is being held this coming week, actually, and we're very grateful. SAMED has been invited. It's being facilitated by the National Department of Health and the Ministry of Finance, and we're hoping that we can really have a deep dive, a kind of whisperat, and we can get our heads together and find solutions to this long-standing issue.
Yeah, because the Minister of Finance is pointing out in his speech that what happens is that money is allocated to the departments. They end up using some of the money of the previous service goods and services rather than the current needs. And then what happens is the cycle continues, that those that were owed in the previous financial year get paid in the current financial year, and those who need to be paid in the current financial year would need to wait longer for that money to be paid.
So that's exactly the situation, and that's been going on for a number of years, where the provinces are using next year's budget to pay for last year's debt. But I think what's even more concerning is that a very significant amount of the debt owed to the 50 members that we've been tracking is about half of that 1.1 billion. So this is not just a recent matter. It's not just recent debt. It's debt that's more than 120 days overdue. So we really need to understand how has that come to occur. And we really need to now look at the systems and processes and see also if we can start streamlining them and maybe using technology in a really clever way to support government to actually create efficiencies and pay suppliers, hopefully in time, within 30 days of invoice.
Is there anything that could be learned from the proposed NHI model around how service providers would be paid? Is that something that we could explore at a provincial level to say that there would be an entity, let's say maybe if it is a treasury unit, that would be the entity that is solely responsible for the payment to the various service providers, instead of waiting on the departments or even the hospitals themselves to process the payments?
So we are very much in favor of universal healthcare coverage. However, as a sector, we don't favor centralization of procurement. We actually prefer that it be decentralized. And the reason for that is, medtech is quite different to pharmaceuticals. You can't give the same 3 or 10 people the same type of tablet. In medtech, you actually have to identify the specific needs of the patient. Sometimes the age and the size of the patient matters. So, for example, you're not going to give a child the same hip if they need a hip replacement as you would potentially an adult. So there are different sizes and nuances that are specific to individuals. So we do believe that procurement needs to be decentralized. Those at a local level who understand the needs of their patients should be able to make decisions around procurement. But I do think that we need greater governance. We need governance structures that can support better decision making, more transparent and accountable procurement. We've heard in the public domain of a lot of corruption around procurement, irregular procurement, irregular audits at provinces. And I think we need to delve deep into what those systemic causes are and start putting in place structures and systems to prevent them going forward.